everyone. Thanks for joining me. I'm Dr. Noah Erickson from Innovative Family Wellness. I'm going to talk to you today about the functional medicine approaches that we offer for people with digestive problems. So whether you suffer from irritable bowel syndrome, which is constipation and diarrhea, perhaps you have GERD, gastroesophageal reflux, acid indigestion, maybe you have problems with colitis and Crohn's disease, and you're looking for answers. Many people go to their doctors and their test. They have a scope up top called an endoscopy. They have a scope down low called a colonoscopy. And thankfully, they don't have any major lesions, tumors, cancer, malignancies, but they're left with debilitating bowel problems. So in a functional medicine assessment, we go further. We ask, could there be foods you're consuming that your body's allergic to? For example, when we test many of my patients here at the clinic, unbeknownst to them, they've been eating foods for years, some of them decades, that are triggering an inflammatory response. So if we look at many of these bowel conditions, there's an underlying inflammatory food connection where those foodstuffs are irritating the inner lining of your gut. That can irritate it so bad, it can actually cause little junctions to open up in the membrane of the intestine and allow food particles that are undigested to leak out and trigger reactions in the joints. Rheumatoid arthritis, crippling of the wrists and hands and knuckles, sore inflamed knees, and many people have leaky gut syndrome and don't make that connection to their skin. You know, I'm trained in acupuncture, chiropractic, nutrition, and we make this connection in ancient Chinese medicine that the liver and the guts relate to the skin. So think of it this way: if you have an apple that went bad on the outside, or an onion that needs peeled off in layers, deep in the core, you could have an underlying problem. So if you make that analogy and apply it to the gut could be irritated, inflamed, toxic, and you could have major problems with your skin. So what we do in functional medicine and in our clinic, we take a sampling of your stool, checking for viruses, parasites, bacteria like H. pylori that can even be associated with causing gastric cancer. Something else we do, many people have a condition called SIBO, small intestinal bacterial overgrowth. This condition can cause belching, indigestion, horrendous gas that many people go undetected. See, your small bowel should be relatively sterile, almost as sterile as your bladder. But what can happen with constipation, with leaky gut syndrome, the foodstuffs can back up, carrying with it bacteria that should not be residential to the small intestine and cause an array of symptoms. In addition to this, many people forget about the gut-brain connection. So people come to me complaining of IBS, diarrhea, constipation, indigestion, acid reflux, and they don't realize the gut is called the second brain. So what we do is we test people's brain chemicals by looking at the profile using urine, blood, and other tests too, where we analyze their stool and their saliva, and we start to understand that your depression, anxiety, irritability, insomnia could be solely because your gut's not making the chemicals. I always tell people, as I work with lots of children, happy serotonin and dopamine for speech, you have to look at this and appreciate that's made in a higher percentage in the gut than it actually is in the brain. So what we do at our clinic is we take a full assessment of you. I listen to your symptoms and I understand. And why I understand is this: over 20 years ago, I had debilitating bowel problems, chronic fatigue. I ended up with skin rashes called eczema, using topicals, trying to do different things orally. Went to the conventional setting. Thankfully, I was ruled out for conditions like lesions and malignancies and tumors. I was left with this diagnosis of irritable bowel syndrome. So that diagnosis didn't really lead me to a whole lot. I asked if food was a trigger. They said it's not. Well, as it turns out, I had to radically change my diet to experience optimal health. In fact, now that I'm in my 40s, I feel better than I did over 20 years ago when I was in my teens. I've gotten rid of pro-inflammatory foods, grains like wheat, and substances in the foods like casein and lactoalbumin, these proteins and dairy products. So sure, I grew up consuming pizza, for example, that combines both the wheat and the dairy, making me terribly sick. But now I've taken that passion, and over a decade in practice, actually it's been 13 years as a medical acupuncturist, a chiropractic physician, and specialize in this new field that we call functional medicine to look for your underlying root cause of the problem. I don't want to cover it up with a Band-Aid. I don't want you to take laxatives and remedies for diarrhea and trying to manage this on your own. We have tests. And the great thing is now these tests tell you specifically, are you allergic to a food or sensitive to a food? See, many people like myself were consuming foods. We didn't break out into full anaphylaxis, but you didn't feel right. Brain fog, fatigue, bloating, gas. And something else we look at too is the underlying digestive capacity of the other organs. So we give things like enzymes. I put people on specialized, customized diets using nutrients like bone broth, right? The critical probiotics and nutrients from kefir. We change your diet radically, supplementing your diet, giving you what I call the Pac-Man of the digestive tract, enzymes. Many people can't break down their food. We look for deficiencies in magnesium. One of the common reasons people are constipated is deficiency in magnesium. So I invite you to come out to the clinic. Look at us on the website. It's innovativefamilywellness.com. We offer these type of tests to deliver you personalized and customized medicine. This is the latest 21st century medicine brought to you. So my patients come, get a lengthy workup looking at lifestyle, family history, social, stress. That's the holistic wellness model that we practice and preach. I myself do the same thing to this day. So I want you to take advantage of this type of medicine, come out to the clinic, receive these testing, find out if you're allergic to food causing irritable bowel. Find out if you need to take probiotics if your gut's healthy, and we'll be glad to look at this further. Check us out once again, innovativefamilywellness.com. That's innovativefamilywellness.com. Join me again sometime. Dr. Noah Erickson, wishing you a great day.